The city of Bloomington pulled samples to check the levels of disinfection byproducts earlier this week. The city is fighting to keep those levels within the EPA standards. As J.D. Gray reports, the measurements taken this week will show whether the city's recent actions are affecting the levels.
From the basement of the city's water treatment plant in a room filled with pipes, about 15 million gallons of water are headed out towards Bloomington residents and businesses every day. Water plays a large role in public health and the economy, and Bloomington is fighting to keep its water in line with federal regulations.
When I came into office January this year, a few months ago, I found out that our water system had this one aspect that was climbing toward the federal safety limits. And I immediately wanted people to know that and to let them know we're going to jump on this and take care of it.
Mayor Hamilton is referring to the level of disinfectant byproducts, or DBPs, in Bloomington's water. The DBPs are classified into two groups. They're either called haloacidic acids or trihalomethanes. Both types are created when disinfectants like chlorine interact with organic matter. Ingesting too many DBPs over time is linked to adverse health risks like cancer. Bloomington sources their drinking water from Lake Monroe, and it contains a lot of organic matter.
And the source of the organic matter can be a broad range of possibilities. It could be natural things occurring in any watershed related to the growth of plant material, to algae growing in the lake, to microbial organisms growing within the distribution system. Any one of those sources of organic material could be precursors to the formation of these disinfection byproducts.
When the city pulls the water in from the lake, they use chlorine to kill microbes. The chlorine creates DBPs when they interact with organic matter. This month, the city made considerable changes to their process. They began removing some organic matter before adding the first dose of chlorine. They've also adjusted how much chlorine they use, and they've started flushing water mains throughout the city. If these approaches work, they could reverse a trend that has been going on for a long time. Bloomington Water's DBP levels have been rising for years.
The data began to just creep up with each testing period. We noticed that we were getting closer and closer. I've written several memos, 10s, 20s, 30 memos regarding the issues over the years.
The city is taking monthly samples of DBPs at 8 locations throughout Bloomington, instead of just the quarterly test that it performed in the past. Between January and March, the city saw its DBP numbers rise. The increases averaged between 10 and 20 parts per billion. For a lot of people, the big concern is whether or not Bloomington's water is safe to drink, and according to EPA standards, it is. The warmer weather means DBPs grow more quickly, but with many of the city's new strategies being implemented this month, it is unclear where the new numbers will lie.
I take it very seriously. I take my job seriously, the community's public health seriously, and so I want to be able to sit down with you next month and show you how much lower we are. I'm cautiously optimistic about sticking that out there before I have the data, but I know we're doing everything that we should be doing.
The results for April's DBP levels are expected in the next 3 to 6 weeks.
I'm holding my breath again, but this time I feel a little bit more optimistic about what results are going to look like.
For Indiana News Desk, I'm J.D. Gray.
AT says if the city exceeds the EPA limit, the violation will be recorded with the State Department of Environmental Management and the EPA. AT says the city is releasing the data, good or bad, so it can easily monitor the progress being made. Results are posted on the city's website. You can find a link on our website at WTIUnews.org.